Hi, everybody. Thanks for joining us today. My name is Taylor Spaziani, and I work for the Sexual Health Alliance. Today, I'm here with Sable from the Center on Colfax. Thank you so much, Sable, for being here with us today.
Great, thank you. Yeah, I'm Sable Schultz. I use she, her pronouns. I'm the manager of the Transgender Services at the Center on Colfax in Denver, Colorado, located at 1301 East Colfax. You know, with our physical space, we're now redefining what our electronic space is and all that. And I've been the manager of the Transgender Services there since September of 2015.
Wow, amazing. That's so cool.
Yeah.
If anybody doesn't know about the center, definitely check it
Mhm.
out. It's an amazing resource here in Denver, Colorado. Super great. Focuses on a whole wide range of age groups. So it's really a great resource.
Mhm.
So before we jump into a lot of the content, I kind of just want to
Mhm.
get to know yourself a little bit better. So
Mhm.
do you want to start off by telling us maybe some of your top 3 bucket list items in life?
Oh my gosh. Well, this experience that we are going through right now really changes
Yeah.
some of those dynamics for me. Um, I think for me, my bucket list has become closer to those pieces that I really do want to achieve in the next year or two. Like, I would like to go on a road trip with sort of a magical student in it and an adventure buddy of mine. Right? There's a road trip back to Tucson that we need to make to see a few sites there that I was familiar with. So that's one thing on my bucket list. I think a thing that's on my bucket list, and I don't know about everybody else, but I think it's going to be more popular, is helping make sure that my own home is more sustainable in times of disruption and crisis, right? And like using this moment to sink in and think about where are my places of vulnerability and what can I do to shore them up? Because I have been very fortunate in this crisis, and it's given me that opportunity to reflect. And I think the third thing on my bucket list would be knowing that I had a hand in helping make the world a better place, like being able to look back and seeing some of my handiwork on that.
Yeah, absolutely. That is so powerful. So I guess that kind of brings us into some of your most important values that you live by every
Mhm.
day. What are some of those?
I mean, one of them is inclusion, right? Looking at what voices we have here in space and what voices we can make sure to uplift and bring into our spaces.
Right, right.
That's a big one for me. Compassion is really strong for me. Even learning learning to understand that each person comes from a very different series of experiences than my own,
Yeah,
um, and for me, resilience, right? For me, that's that kind of keeping moving forward.
absolutely. Thank you for sharing that. I appreciate it.
Mhm.
So one question that we like to ask a lot of people involved with the Sexual Health Alliance is, who is your gender or sexuality role model?
Gosh, you know, so I'm gonna give kind of the Libra answer of like there's not just ever one.
Yeah.
There's so many people that I've met and that I've seen who have just really worked to embody, you know, themselves and their passions. And so, in a way, it's my role models are every single person who feels confident enough to own and declare their sexuality, regardless of where that might be. In a way, um, I have a magical student who's asexual, right? And in a way, I am allosexual. Am I have partners, I have sexual partners. But in a way, both my primary live-in partner and my student are asexual individuals, and their ability to know and own and understand themselves and speak their truths,
Yeah.
that's a role model. That's an inspiration to me.
Absolutely.
And giving me the opportunity to uplift their experiences.
So important. I think authenticity is so admirable in anybody. So I really hear your passion when you speak about that.
Mhm.
Speaking to your identity as a trans or non-binary or gender diverse individual, can you remember a time where people have tried to be an ally to you, but maybe missed the mark?
Hmm. Um, I think one area where that may have occurred, where there is a desire to be an ally, and I want to be respectful of the people involved, so I'm going to be kind of vague and just sort of like couch it in a higher term rather than a specific example. Um, when a person who has not been in that experience, who's not part of that transgender diverse community, um, when they're at a state and they really want to provide some assistance and help, and they want to create a framework for trans folks to be able to communicate, but don't understand
Mm.
what our communities use those spaces for, right? Would be kind of that. So a person who's not in community who creates a structure or wants to create a structure for members outside of the community without really checking in or getting that feedback. And so it's it creates a lot of frustration, right? So there's a tension that comes from folks inside the community that's um, don't define this stuff for us. We know what we want, and this is what we need you to do. And the person outside is working with this, wanting to, like, these are their limitations, and this is what they want to share. Um, so it butts up against that, and it creates a friction and creates a lot of hurt feelings. And so it winds up creating more pain for both community members and people who want to be, allies and advocates.
That makes a lot of sense. And thank you so much for sharing that with us.
Mhm.
So, when was a time that maybe a person may have provided some kind of unexpected support or allyship that you had not thought about before it happened?
So I have a really cutesy one that immediately comes to mind, which was the first time I went to utilize a healthcare service,
Yeah.
a new healthcare provider, and um, they they wound up giving me a little bottle and go to the little restroom and go pee in the rest, you pee in the cup. And as I was like, that's very odd. I didn't expect that. Um, and then they came back and they're like, sorry, I misunderstood. And they took the little cup away. And basically, in that way, what they showed is like, one, they realized that they needed to double check all of the details because when I later pieced it together, I was like, oh, pregnancy test. It was a college and university campus. Like,
Right.
that's a concern for a lot of folks, right? Even off campus. But anyway, so it made me reflect on that. Then they made that connection. They realized, and they just quickly like, oh, I apologize. This, yeah, and moved on. And so those moments of being able to release guilt, right, from the mistake that was made, and move on and make correction from there on out and change the course of your behaviors, your patterns, is sometimes the greatest source of um, advocacy and allyship I think that there can be out
Absolutely. That's a beautiful example. I think that really pinpoints a lot of
there.
the issues around it and how we can move forward in those moments.
Hmm.
So, with that, can you give us maybe 3 ways that people can be an ally to trans or non binary or gender diverse
Hmm.
communities and populations?
So the number one that I always give. So I do trainings as part of my work, and one of the things that we have our folks do is we do a name, gender, or name, pronoun, and motivation check-in. And I have them all do this as part of my opening thing. And the reason being is that because I think one of the number one things is sharing your pronouns when you meet somebody, any person, every single person. And I know I forget it too, right? Like, and so I try to slip it in later on if I need to. Um, and so I might have forgotten it on this. I don't know. We'll go back and see, I
You
guess.
remembered, you said it.
um, but doing that, and so I'll tell them, like, yeah, it feels really awkward the first 100 times you do it, and so that's one time down, right? They just got to go 99 more. So I think that, um, I think, um, I think if you are in a space where it may be a specific container where people may feel comfortable about coming out, things like that, being able to say things like how do you wish us to refer to you in this space, or how do you wish us to refer, recognizing it, that also recognizes, of course, that outside of some spaces some people might not be out. So I'm like, how do you want us to refer to you today? What pronouns would you like us to use for you in this space? So checking in on that and just moving on if it gets a little bit too muddled, again. And then again, that grace in, we step on toes. I step on toes. I make mistakes. I have had people that I love dearly come out to me after I've known them, and I've made mistakes. And so my work as an ally for my loved one becomes recognizing my mistake, letting go of the guilt and shame that
Mhm.
bubble up inside me, and just work on not stepping on those toes again. I think that's
That's beautiful advice. Thank you so much, Sable. Before we end, I kind of just want to roll out the red carpet for you and
mhm,
give you an opportunity to share with the world and our conference attendees some of the work you're
mhm,
working on or passionate about.
mhm.
And what would you like everybody to know?
Oh my gosh. Well, I mean, of course, there's the community center work that we're doing, and this is really redefining a lot of the work that we're doing. And so it really underscores a deep passion of mine around making accessible structures and recognizing, and this especially these times, we are starting to see this need for greater accessibility for everybody. And so it's that passion of listening to the people who are in the most vulnerable positions say what they need and building up from there. So I know it's big and it's not a specific target, but that's just my
Yeah, it's great. Thank you so much. And
thank you.
I really appreciate you doing this interview with me today. I hope all of our attendees appreciate listening to you as much as I did. So thank you so much,
Thank you.
Sable.
Great. Thank you.